It's a pleasure to have you join us on another episode of the program. I am Ogechuku Ukekwe. The Federal Executive Council (FEC) has approved the purchase of 7,887 dialysis consumables to enhance healthcare access for citizens suffering from kidney diseases. Minister of Health and Coordinating Minister for Social Work Ali Pati disclosed this while briefing State House correspondents at the end of the council meeting presided over by President Bola Tinubu at the council chamber, Presidential Villa, Abuja. He said the approval aims to address the rising prevalence of non-communicable diseases such as hypertension and diabetes. The consumables will be distributed across 7 federal territory hospitals, including the University of Benin Teaching Hospital and the National Hospital in Abuja. President Bola Tinubu has approved the creation of the Sector-Wide Coordinating Office Program Management Unit, a new health sector coordinating unit aimed at enhancing the management of external grants for Nigerian Health Sector Renewal Investment Initiative. According to the statement by the presidential spokesperson, Ajiro Ngalale, the SCOPMU will ensure efficient, transparent, and accountability management of grants, reporting to a steering committee chaired by the Minister of Health. The unit's functions will include program management, monitoring, and evaluation. This new unit demonstrates President Tinubu's commitment to strengthening the healthcare sector and ensure effective management of resources to achieve the goals of the NHSRLL. We'll go on a short break and we'll be right back. Welcome back. Hepatitis is an inflammation of the liver commonly caused by viral infection, although it can also result from autoimmune diseases, medication, toxins, and alcohol abuse. Viral hepatitis is a significant global health issue, affecting millions of people worldwide. There are several types of viral hepatitis, each caused by different viruses, including hepatitis A, B, C, D, and E. Viral hepatitis is a leading cause of liver diseases and mortality globally. Prevention strategies include vaccination, safe injection practices, blood screening, and improved sanitation. Efforts to increase awareness, access to testing, and treatment are crucial in reducing the burden of viral hepatitis worldwide. Well, joining me on the program to discuss further is National Coordinator Civil Society Network on Viral Hepatitis in Nigeria, Dr. Ekanem. Thank you for joining me on the program, Doctor. So what would you say hepatitis is, and what are the different types? That's the A, B, C, and D hepatitis, and also explain how they differ.
Okay, thank you. So hepatitis, as a term, refers to the inflammation of the liver. It is actually a term used to describe a set of diseases that undermine the functioning of the liver. Hepatitis could be caused by a viral agent or could be caused by a non-viral agent. For the non-viral hepatitis, we have those caused by alcohol or the harmful use of drugs. But for the viral hepatitis, they are further classified into 5 types. And depending on the type of the virus, they can be classified into hepatitis A, B, C, D, and E. Hepatitis A and E are similar because they are the enterohepatitis, or what we call those hepatitis that are transmitted from one person to the other through contaminated food and water. So when an individual or a susceptible individual consumes food or water that has been infected with hepatitis B virus, with hepatitis A or E virus, that individual comes down with the virus. But the interesting thing is that hepatitis A and E are self-limiting. So yes, they manifest those acute symptoms, but they will definitely go within a 6-month period because they actually are self-limiting. They cannot go into a chronic phase. So hepatitis A most times is found among people living in riverine areas or among people that do not practice environmental sanitation or personal hygiene. People who make contact with fecal matter, or perhaps from those who were previously infected, are likely to come down with hepatitis A. For example, there is an outbreak of hepatitis A virus in Sudan, and good enough, the Gavi and other partners have joined hands, have collaborated to provide vaccines to help reduce the burden of the epidemic in Sudan. Hepatitis E is also transmitted through the oral fecal route. So most times, cases of hepatitis occur when an individual uses his or her hands after using the latrine without proper hand washing. While hepatitis A occurs frequently, hepatitis E occurs very infrequently. It occurs once in perhaps a decade. But these viruses are vaccine preventable, and they can cause severe symptoms, but mortality as a result of hepatitis A and E is lower, far lower compared to hepatitis B and C. Now, hepatitis B is the second type of virus, hepatitis virus, and it is basically transmitted through an exchange of blood or other body fluids. For example, semen, vaginal fluid, breast milk, and many other plasma and other bodily fluids. Some people believe, some studies have shown that there are scanty amount of hepatitis B virus in the saliva. But studies have shown that the quantity of hepatitis B virus in the saliva is not significant enough to cause infection, especially for unbroken skin, which is why hepatitis cannot be transmitted through kissing. That's for hepatitis B, cannot be transmitted through kissing, but basically through blood transfusion. When an individual is transfused with an unsafe blood or blood that has been contaminated with hepatitis B, such an individual is likely to come down with hepatitis B. When an individual has sexual intercourse, unprotected sexual intercourse, or condomless sexual intercourse with a hepatitis B patient, there are chances that such a person may come down with hepatitis B. Mother-to-child transmission is one of the most effective strategy, or the most effective mode of transmission of hepatitis B virus. Women who are pregnant and they have been diagnosed with hepatitis B have a chance of passing the virus to their children or to their unborn children during pregnancy and after pregnancy during delivery, which is why it is important that antiviral post exposure prophylaxis are administered to children who are born to hepatitis B positive mothers. Also, hepatitis B is transmitted among injection drug users, or better put, people who inject drugs. It's also found among men having sex with men. It's also found among infants in playground. Anything that will cause exchange of fluid from one individual to the other, where one person is susceptible and the other is infected with hepatitis B virus, there is a possibility of a transmission. This is different slightly from hepatitis B, from hepatitis C. Hepatitis C, yes, is transmitted through exchange of sharp items like needles, razor blade, nail cutter, hair clipper, all sorts. Hepatitis C is mainly found among people who inject drugs, because these people are fond of exchanging the syringes they use from one person to other. Sometimes, for people who make tattoo, they are likely to come down with hepatitis C. So these are the difference between hepatitis C and hepatitis B. Now, hepatitis D is a super infection of hepatitis B. You must have hepatitis B for a while before you now develop hepatitis C or hepatitis D. So it is not possible to see people with hepatitis D without previously being infected with hepatitis B.
So you mentioned mother-to-child transmission of hepatitis B. How can this be prevented?
Yes. So for prevention of mother-to-child transmission has been found to be one of the most cost-effective and the most reliable approach to reducing the burden of hepatitis B. The strategy to reducing it, first of all, is to screen pregnant women, to first of all even know whether the pregnant woman, is infected with hepatitis B. Now, having screened those women during their antenatal visits, for women who are living with hepatitis B, the next step is to identify the viral load or the viral burden through carrying out what we call a viral load DNA count. Once that is identified and the viral load is considerable, then there's need to initiate immediately an antiviral prophylactic regimen or treatment. Prophylaxis means the reason why that antiviral is administered is to be able to prevent the unborn child from contracting the virus through the placental barrier during pregnancy. So when this antiviral is administered, we have very safe antiviral that can be administered from the second semester from the second trimester rather of pregnancy. This will reduce the viral load in the mother such that the viral load will become too negligible to cross the placental barrier and infect the unborn child. When that child is now eventually born, it is advisable that a particular vaccine, so to speak, called hepatitis B immunoglobulin is administered to that child. The reason is to ensure that that one is what we call a post-exposure prophylaxis. And the reason why we administer that to children is to ensure that when they have that contact with maternal blood during delivery, they do not come down with hepatitis. That contact with maternal blood that is positive for hepatitis B is an exposure. So we are giving them that post-exposure prophylaxis, the hepatitis B immunoglobulin, to protect them from coming down with hepatitis despite being exposed to blood that is contaminated with hepatitis B.
What would you say are the early signs of the different types of hepatitis that we have that people should be aware of? And also, what are the most risk factors for contracting hepatitis B? That's especially for B and C, which happens to be the most common amongst all.
Okay. So the common symptoms, I would say that, first of all, we advise that patients should not wait until they have those symptoms, because when symptoms begin to manifest, that means the liver has been overtaken by the virus. That means even perhaps there's already considerable cirrhosis of the liver. There's considerable damage to the liver. And possibly there's already liver cancer. And unfortunately, liver cancer doesn't give enough time to facilitate liver transplant. So patients should literally not wait for the symptoms to manifest. Nevertheless, there are key symptoms, there are early symptoms that manifest and points to the presence of viral hepatitis B and or C. The first is jaundice-like symptoms. So you begin to observe that the eye is getting yellowish in color. If you look at the skin is turning yellowish, greenish yellow. If you look at the urine, it is already becoming dark in color. Of course, it progresses from the normal color to yellowish to dark yellowish before you know what is already brownish in color. The stool becomes tan in color. There is fatigue, and the fatigue increases as the situation deteriorates. At a point, appetite is completely lost. That one also increases as the disease progresses. There is headache, there is malaise, there is fever, there is abdominal pain. In many patients, they will be complaining of abdominal pain. Sometimes patients do complain of loss of weight. Also, some patients do complain of waist pain. These are all symptoms of viral hepatitis. And when these things manifest, then it shows that they are in an acute and perhaps very, very sensitive aspect of part of the viral hepatitis life cycle. These acute symptoms can manifest sometimes within the first 6 months of infection. This is what we basically call the acute phase of the disease. Sometimes they may manifest later on, way beyond a year. At that time, though they are acute symptoms, but the patient is already a chronic patient. These symptoms are common for all kinds of hepatitis, whether it's hepatitis A, hepatitis B, hepatitis C, hepatitis D, and even hepatitis E. They have common signs and symptoms. It is during diagnosis that the type of the virus is identified. So you see patient with hepatitis A manifesting exactly the same symptoms with somebody with hepatitis B. But what is important is that patients should not wait until that time, because these symptoms, some of them can be extremely, extremely dangerous, and in many cases, fatal. Like it is said, every 30 seconds, one person dies of hepatitis. This is not statistics. These are people like you and I. So since we started this conversation, I'm very sure that we've probably lost more than 20 people. So we need to actually step up our game and make commitments so that we can save the life of people and stop the next generation from coming down with viral hepatitis. And in your next question, you asked about the risk factors. What are the risk factors for viral hepatitis? It depends on the type of hepatitis. And like I said, for hepatitis A and E, hepatitis A and E, the risk factor is contaminated food and water. So consumption of contaminated food and water is a significant risk factor. So poor personal hygiene, poor hand hygiene is a very important risk factor when it comes to hepatitis A and E infection. Staying around, locating your house close to latrines, like we see in some of our metropolitan areas, is one of the risk factors. Drinking unsafe water is another important risk factor. Eating food that are not properly cooked, especially aquatic foods, is another risk factor. So hepatitis A and E are those hepatitis that occur, that are contracted when an individual eats food or drinks water that is contaminated. So all the public health measures or all the public health risk factors associated with eating contaminated food, whether it's hand hygiene or environmental sanitation, all of them are risk factor or risk factors to hepatitis A and E. For hepatitis B, C, and D, the risk factors are very simple. Anything or any approach or any attitude or any behavior that would make you have a contact with another person's body fluid, whether it is the blood, the plasma, the semen, the vaginal fluid, the breast milk, all of this are significant risk factors that can increase the chance of coming down with hepatitis. So, with all these risk factors mentioned, it is important that we watch out for them and ensure we keep ourselves safe from it. But what is the golden rule? Get vaccinated so that even if you are exposed to any of these risk factors, you'll be protected from hepatitis B. Though hepatitis C does not have a cure or does not have a vaccine, it has a cure. So if you come in contact with hepatitis C and you are infected, you can access a cure and you can get rid of it. Thank you.
So you mentioned there are vaccines for the viruses. Aside vaccines, are there any other available treatment for the types of hepatitis we have? Then especially for B and C, which happens to be the most common in Nigeria.
Yes. So there is available treatment for hepatitis B, a very effective treatment that helps to reduce the viral load. I may not be able to mention the name of the drug, but they are antiviral drugs. We call them directly acting antiviral medications. Prescribers have the authority to prescribe this medication based on the clinical status and the need of the patient. Interestingly, the World Health Organization has reviewed the guideline. Now we have already brought down the threshold for being eligible for treatment. What that means is that a lot of people will need to be on medication because for hepatitis B, the medication is lifelong. Interestingly, the sister, hepatitis C, has a cure. It has a short-term cure that can be achieved in 12 weeks or a maximum of 6 months. So there is an effective treatment for hepatitis B and there is a cure for hepatitis C, which is why it is possible for us to have a next generation free from hepatitis B and C if we treat those with hepatitis C, B, and cure those with hepatitis C.
Are there any long-term effects or complications of untreated hepatitis? And also, how can individuals manage hepatitis to prevent complication and improve their quality of life?
Okay, thank you. So hepatitis as a term refers to the inflammation of the liver. It is actually a term used to describe a set of diseases that undermine the functioning of the liver. Hepatitis could be caused by a viral agent or could be caused by a non-viral agent. For the non-viral hepatitis, we have those caused by alcohol or the harmful use of drugs. But for the viral hepatitis, they are further classified into 5 types. And depending on the type of the virus, they can be classified into hepatitis A, B, C, D, and E. Hepatitis A and E are similar because they are the enterohepatitis, or what we call those hepatitis that are transmitted from one person to the other through contaminated food and water. So when an individual or a susceptible individual consumes food or water that has been infected with hepatitis B virus, with hepatitis A or E virus, that individual comes down with the virus. But the interesting thing is that hepatitis A and E are self-limiting. So yes, they manifest those acute symptoms, but they will definitely go within a 6-month period because they actually are self-limiting. They cannot go into a chronic phase. So hepatitis A most times is found among people living in riverine areas or among people that do not practice environmental sanitation or personal hygiene. People who make contact with fecal matter or perhaps from those who were previously infected are likely to come down with hepatitis A. For example, there is an outbreak of hepatitis A virus in Sudan, and good enough, the Gavi and other partners have joined hands, have collaborated to provide vaccines to help reduce the burden of the epidemic in Sudan. Hepatitis E is also transmitted through the oral fecal route. So most times, cases of hepatitis occur when an individual uses his or her hands after using the latrine without proper hand washing. While hepatitis A occurs frequently, hepatitis E occurs very infrequently. It occurs once in perhaps a decade. But these viruses are vaccine preventable and they can cause severe symptoms, but mortality as a result of hepatitis A and E is lower, far lower compared to hepatitis B and C. Now, hepatitis B is the second type of virus, hepatitis virus, and it is basically transmitted through an exchange of blood or other body fluids. For example, semen, vaginal fluid, breast milk, and many other plasma and other bodily fluids. Some people believe, some studies have shown that there are scanty amount of hepatitis B virus in the saliva. But studies have shown that the quantity of hepatitis B virus in the saliva is not significant enough to cause infection.
Well, National Coordinator, Civil Society Network on Viral Hepatitis in Nigeria is Dr. Ekanem. Thank you for lending your thoughts on the program. And that's all we have on this episode of the program. See you next time.